Good afternoon. Happy Saturday. This is the Live with Dr. Regina Rae. I am Dr. Regina Rae, board certified OBGYN, national speaker, and your women's health expert. Thanks so much for joining me today, Saturday afternoon of a week of a month. Thank you so much for joining me, Jessica. I am wearing a couple of hats today, as always. I am an alternate delegate for the state of Ohio for the American Medical Association, and right now we are conducting our first virtual meeting where we are actually voting on legislation and resolutions that have been put forth by various states here in the U.S. and stepped away from that computer to come on with my Live with Dr. Regina Rae to address any questions we have today. I thought today we would take a break from covering a particular topic to answer any burning questions that our audience may have today. So I did post on yesterday and encouraged anyone who might have had any specific questions to send them so that we can answer them. And I didn't get any. So it sounds like we are all comfortable with our anatomy. We are comfortable with the understanding of our cycles and how we become pregnant, how we can avoid pregnancy. We are familiar with our anatomy and various infections. It looks like there is a question about yeast infection. So we'll get started on that question, and while there are any other questions that may come to mind, please do put them in the chat so that we can get them addressed. So there is a question on the board here regarding yeast infections. Why do yeast infections occur? How can we minimize the frequency of developing yeast infections? My response is yeast infections occur when there is a pH imbalance in the vagina. In the vagina, there is bacteria and yeast all the time. The natural bacteria of the vagina is called lactobacillus. We may hear about lactobacillus as we think about or read fine print in various yogurts. Lactobacillus is the natural bacteria of the vagina and is found in most yogurts. The natural yeast of the vagina is also present, and those numbers they exist in equal numbers at a slightly acid pH. However, when our pH is offset, meaning our pH of the vagina becomes very basic, then that means that the natural bacteria of the vagina dies off. Other bacteria can come in and bring about excessive discharge or odor or itching, and as a result, we have the most common vaginal infection called bacteria vaginosis. The most common bug that does come in to bring about a headache is called Gardnerella. When the pH of the vagina becomes very acidic, then the natural yeast of the vagina can overgrow the natural bacteria of the vagina. And that can bring about a discharge that is often clumpy, kind of watery, more itchy than odor, and that can bring about some irritation as well. What we typically do to treat that is an over-the-counter monostat is reasonable. Sometimes we write for a prescription called diflucan, and what that does is bring the colony count of the yeast back down to an appropriate number where the lactobacillus bacteria and the yeast can coexist in harmony again without causing the host symptoms. Now, what are some of the things that can change the pH of the vagina? Changes of soaps, changes of body washes. The perfume and soap industry, it's a million, if not billion-dollar industry where there are different scents that are created and that we love, especially around holiday time and special occasion time. But I strongly encourage patients to stick with the same soap that you wash your body with. Use that same soap if you choose to take a shower or bath or a bubble bath. And if there's a special scent that you like produced by Bath and Body Works or Victoria's Secrets, that you use the lotions. Use the lotions or the oils or the body spray. Avoid using the bubble bath or anything that may enter into the vagina and can upset the pH of the vagina, bringing about vaginal discharge, irritation, and imbalance, infection. So, again, the most important thing to avoid a pH imbalance would be to stick with the same soaps and body washes. So if Dial works for you, if a natural pH body wash will work, if some of the other products on the market, if those things work for you, then just stick with those things and use your special Christmas scent, lotions and oils or body sprays to get you the scent that you enjoy. Other things that can bring about a change of the pH of the vagina can be potentially a recent course of antibiotics used to treat for something else. So we are currently in the season of upper respiratory infections, and if you've had a recent upper respiratory infection or ear infection or urinary tract infection, oftentimes we treat those with antibiotics, and as a result, those antibiotics go through the body, they're processed by the liver, and as they are going through each stage of the body, they can change the pH of your gut and the pH of the vagina, unfortunately bringing about an imbalance, which could give you a secondary vaginal infection. Other things that may change the pH of the vagina that you may have noticed through experience is enjoying vacation, where you've been in seawater, where seawater or ocean water has its own microcosm of bacteria and plankton that can change the pH of the vagina. If you have been in a hot tub, understand that it's not the hot tub that is an area that has not been cleaned properly. The hot tub actually increases your core body temperature higher than your natural body temperature, and that can change the pH of the vagina. So for patients who like to work out and then go into the sauna room, you want to make sure that you come out of those clothes immediately, and it's quite possible that you may notice a slight change in your vaginal discharge. Also, if you're an avid swimmer, you are getting into water with chlorine, and the chlorine has to be at a certain concentration in order to ward off infection since it's often a public pool, and that sometimes does not agree with the vagina. And so as a result, sometimes one can notice a change in baseline discharge and subsequently develop either a bacterial infection or yeast infection. One final thing that may sometimes be an oversight: if you have a history of diabetes and your blood sugars are not adequately controlled, things that can upset your blood sugar maintenance can be local infection, UTI. But if your sugars are not adequately controlled, then you're peeing off a lot of sugar in your urine. And as a result, the pH of the vaginal area around the urethra is more acidic, and as a result, we have more yeast infections. So for those who may suffer with diabetes and sugars are not controlled, you may also be noticing that you're having recurrent yeast infections, and that is probably the reason why. So hopefully we have a better understanding now regarding recurrent yeast infections or bacterial infections and how to avoid that. Let me go here to the chat. There are a couple questions. One was, is shaving or non-shaving pubic hair good or bad? What are my thoughts? Well, it is my opinion that hair is there for a reason. The hair is there to capture potential bacteria and keeping it from getting closer and more intimate into the vagina. But hair also harbors odor because the bacteria is often present along the hair shaft and the hair follicles. So my recommendation is it's a personal preference. It is there for a reason, but it does come with it pluses and minuses. So if we're going to clip hair, or if we're going to remove hair, I recommend that you use clippers. It is important that as you shave, if you're going to shave, that you shave in the direction the hair grows and not in all different directions that we often use when we are shaving underneath our arms. Because if we're shaving in all directions, oftentimes the hairs are confused as to which direction they should grow when they come back in. And shaving in all directions can contribute to the development of hair bumps and ingrown hairs. And so the best thing to do would be to clip. The next best thing, if you're going to shave, is to shave and shave in one direction. Waxing and complete depilatory products are nice as well, but you have to keep those practices up in order for the hairs to continue to come in thinner than the previous hair growth. And so if you're going to initiate that process, you want to keep up with that process to keep the hairs coming in thinner and thinner. So that is my opinion regarding pubic hair. I think hair in every location is there for a reason, but, it may not, I would say, satisfy some of our social norms in terms of odor. But there are some cultures who don't shave hair at all, and that's fine too. The hair is there for a reason, but you can govern yourselves accordingly. Just be sure to shave appropriately, as we just discussed, or if you're going to clip the hair, just clip the hair and keep it short. Or if you're going to wax, you want to maintain that practice in order to keep the hairs coming in a thin manner. All right. there is a question. I'm curious if there are any new advancements related to preeclampsia besides a daily baby aspirin. Good question. There, so it's interesting. Oftentimes in medicine, we kind of operate in our own silos, and in the field of primary care, they have further stratified the degree of hypertension. And recommendations are that we begin treating hypertension when the blood pressures are greater than 130s over 80s. So we don't want to wait until we get to 140s or greater than 140 up top or greater than 90 below. The recommendation is to begin treatment when blood pressures are 130 or greater or 85 or greater. So many of us are becoming a bit more aggressive when patients are coming into their pregnancies early on, and if we're noticing that their blood pressures are starting out on a high normal range, that we pay close attention, and we may actually introduce meds, but that is not a general consensus from the OBGYN side to initiate treatment unless the blood pressure is greater than 140 up top or greater than 90 below. But it is universal consensus that we give patients who have a history of preeclampsia, hypertension, chronic hypertension, gestational hypertension, excuse me, or any medical conditions that can have an impact on kidney function, like lupus, like diabetes, that we initiate a baby aspirin as part of your normal daily regimen in pregnancy to minimize your risk in the development of preeclampsia in the current pregnancy. Okay, getting back to the question about yeast, there was a question, should I implement eating more yogurt? Certainly that you can do. The lactobacillus is called Lactobacillus acidophilus, and it is also found in a supplement capsule form. So if you are dairy or milk intolerant or lactose intolerant, you can incorporate lactobacillus in a capsule form as part of your daily diet as well, and that has been shown to decrease the recurrence of yeast infections or vaginal infections in general. The literature is, I would say, inconsistent. You have an equal number of articles that say supplements do help with recurrent vaginal infections or help with decreasing, and then you have probably an equal number of articles that say the supplements don't help. But for those patients who do experience recurrent infection, and we've ruled out other sources of bacteria as the cause, I do recommend that you consider a daily supplement of lactobacillus. I did find an article produced by a Harvard source that recommended up to 10 billion CFUs a day. CFU stands for colony forming units, and one can take up to 10 billion CFUs daily in their diet to help offset the recurrence rate of vaginal infections. So we can certainly start off at 5 and then increase to 10, but although there are capsules out there that come with 25 CFUs, 25 billion CFUs in them, This particular article suggested that 5 to 10 billion should suffice. Okay. Looking here, were there any other burning questions? We talked about vaginal infections. We talked about, one other thing about vaginal infections that we may not have mentioned. Again, the most common source of bacterial vaginosis is a bug called Gardnerella. However, we all can acknowledge that the orifices, the holes in our genital area, become very closely affiliated when we are down in the vaginal and vulvar area. We have the pee hole or the urethra that is within centimeters of the vaginal opening, and then we have the anal area. Sometimes, depending on our sexual activity, it's possible to bring bugs from the gut up into the vagina. There may be some of us who enjoy anal activity. If you are one of them, the recommendation would be to make sure that you are cleaning as you go from one location to the next. Otherwise, you're bringing the bugs that naturally live in your gut into the vagina, and everybody's a little territorial about their space. So the natural bugs of the gut include E. coli, just trying to think of a few others. E. coli, we have Enterococcus bacteria. Those are bugs that live in the gut normally. But E. coli is actually the most common bug that causes a urinary tract infection. How does it get from the rectal area to the vaginal area or the urethra? Sometimes we can have, an issue with diarrhea, and you have water, kind of splashing back up in the perineal area. Sometimes we are wiping from back to front, and we're bringing what's in the back to the front area, and that can contaminate the urethra area, increasing one's risk for urinary tract infection, and also potential activity. So, depending on your foreplay, depending on your activity, it's important that you clean as you go from one place to the next. That would include oral activity, making sure that your partner's oral hygiene is in check, and that we have, no presence of any abscesses in the mouth. We have good dentition. We are flossing well, because whatever we're bringing in from the mouth and introducing to the vagina, that can potentially upset the vaginal flora of the vagina. Also, because there are other bugs that can bring about the symptoms of bacterial vaginosis or recurrent symptoms of a yeast infection, if you've been treated a number of times for a yeast infection or for bacterial vaginosis and it seems to recur again, I would encourage you to ask your provider to culture you for other strains of bacteria present, because it is possible that there is more than one strain of bacteria present, and we're only treating for one and not the other. Or we could have both bacteria, and maybe the bacteria is E. coli and yeast, and not the traditional Gardnerella that responds to flagell. E. coli does not respond to flagell. Flagell is the most common antibiotic used to treat bacterial vaginosis, but you have other strains of bacteria in the vagina, or that can be in the vagina, that don't necessarily respond to that. So again, if you have recurrent infection, can't seem to figure out what's going on or what you might be doing to contribute to its recurrence, then my recommendation would be to have your provider to culture you for other strains of bacteria to make sure that we are addressing the bug present. All right. Any other questions? Thanks so much, Michelle, for joining. And Miss Marquise. And Miss Sally Pearl. Thank you so much for joining us today. Do we have any burning questions? Any burning questions? Vaginal dryness has been a topic of discussion, and there are many patients who may not necessarily be interested in hormone therapy. What are some alternatives to treating vaginal dryness without necessarily subjecting oneself to estrogen? One can consider olive oil. Olive oil is a natural oil. We could also consider some of the over-the-counter lubricants. Feedback that I've gotten from patients is that the products that have oh my goodness, I've had a brain fart. I'll think of it in a second. But there are some products, so certainly water-based products work. You do have products that are, you have water-based, you have oil-based. It's important to recognize that any oil-based products can break down latex products, so you want to be careful if we are using protection that you are safest in making a decision for a water-based product. If we're going to use oil-based, then it needs to be a non-latex product. I can't think of the name, but there is a product that is associated with some of the lubricants over the counter that stays slicker longer. Silicone, that's what it is. So silicone-based products stay slicker longer and don't have a lot of buildup or get sticky and dry and irritated over time. And so definitely silicone-based lubricants and condoms that have silicone lubricant as part of them, they seem to stay slicker longer and are more comfortable. So definitely we can consider those products as alternatives to an estrogen product to help with natural lubrication. Okay, so there was a question about Vaseline. I'd say no to Vaseline. Vaseline is very viscous, is very thick, and it sticks to the skin a lot longer, so I would say no to Vaseline. No to Vaseline when it comes to vaginal lubrication with intimacy. Olive oil. We can also consider there is another natural oil that I've gotten good feedback with that I will come to mind. It will come to mind in just a few seconds. I'm being met with lots of stimuli, I'd say, on this screen between comments coming in from you all and comments coming in from my Ohio delegation regarding our reference committee meetings and that type of thing. But I am just so glad to be here, and I thank God for technology to allows us to be able to reach out and communicate with one another in this. Okay. Well, it looks like going once, going twice. Well, thank you. Thank you, everybody, for joining in today. Today, live with Dr. Regina Rae. It is always a pleasure to join with you and answer any questions that you may have, share in the knowledge that I've been blessed with, and I am always excited to be here. So thank you so much for joining me. Again, feel free to reach out on any platform. I am on most platforms as Dr. Regina Rae OBGYN. That is DRREGINA RAE OBGYN, and you can spell that out. And you can find me on Facebook as well as Instagram, LinkedIn as well. But I'm more commonly connected to our Facebook and our Instagram. So please reach out with any additional questions you may have. I do have an email address, Dr. Regina Rae OBGYN @gmail.com. Thank you so much, and we look forward to connecting next week. Until then,